Now it's my great pleasure to turn over the program to our colleagues at the UN Foundation for a really great series of announcements about some of the initiatives that will help to drive innovation forward in the very near future. So if I could ask Susan Myers to join us on stage from the UN Foundation. Let's give her a round of applause.
Well, thank you, Dan, and thanks all of you for being here. My name is Susan Myers. I'm the Vice President of UN Relations at the UN Foundation. So as you can tell, I spend a lot of time thinking about the UN, which is one of the reasons that I'm so happy to be here in Norway with our board of directors, where we've had a great couple of days talking with people about the UN, about all the ways that Norway is working with the UN and how we can really deepen our partnerships there. You heard from some of our board members yesterday. I hope you've had a chance to meet some of my colleagues that have been here all day. Kate Dodson, who's our Director of Global Health Integration. Leslie Cordes, who's been instrumental in starting up the Alliance for Clean Cook Stoves, and you just heard a presentation about why that issue is so important. And Jennifer Potts with our mHealth Alliance, who I'm going to call up to the stage momentarily to talk about an initiative that's happening with the mHealth Alliance. But I just wanted to say the reason our board is here and the reason why we have so many staff here is not only because of our strong commitment to global health, but because we have also stepped up to what Sharon called the SG's call to action on the global strategy for women and children's health. And you see that we put up this banner here, Every Woman, Every Child, which represents what is becoming a truly global, energetic effort in response to the Secretary General's leadership. So in addition to all of the ways the UN Foundation was working on global health issues and harnessing what we can do at our organization to respond to that call to action, we've also taken on a role as part of our support for the UN and being a platform for connecting people, idea, and resources to the UN to encourage others to get involved in support of the Secretary General's leadership. So I have the exciting job today of calling some others up to the stage so you can hear what they're doing in response to this new initiative. So I'd like to start with Jennifer Potts with the mHealth Initiative. She's going to give you a short presentation on Health Unbound, which goes by the acronym HUB. So thank you, Jennifer.
Thank you, Susan, and thank you everybody for being here. I am representing my good compatriots at the mHealth Alliance working on the Health Unbound website. So a few weeks ago, I guess I should press this. A few weeks ago, we were in a conversation with Dr. Richard Gakuba of Rwanda, and the conversation sounded strangely familiar to me, deja vu. And I kept wondering, well, why is this so familiar? Well, it was because I'd been talking also with the Philippine government, saying with their Women Watching Over Mothers and Newborns program and the mobile applications for that, and the work that Dr. Gakuba had done in Rwanda was exactly the kind of work that the Philippine government was looking forward to also doing. So the question that comes is, well, what do we know about the programs that are already happening? How is it possible for Dr. Gakuba to help the Philippine government? And so with that, and all of the programs you see here, and there are probably more than 700 that will bundle in the Health Unbound website. And so we think that one of the answers, collectively, is to have the Health Unbound website. So this is the Health Unbound web portal. The mHealth ecosystem is vast. We know that. The private sector, public sector partnerships is vast. Do you know how many mHealth programs exist in your country? Imagine the delight a couple of weeks ago in Cape Town when UNICEF in Uganda discovered that they had over 60 mHealth projects in Uganda. They didn't know that. Neither did the Ugandan government. I had a conversation with one of my colleagues at World Vision. World Vision is a vast 400,000 employees, we heard earlier today. Lots of decentralized power there. They don't know how many mHealth projects they have. What if they were to run a competition on Hub, saying who's got the best, among the world vision world, who has the best mHealth project. We could run a competition. They could be awarded some amount of money that might help them bring something to scale where they are. There are all sorts of ways that we can use Hub. Hub has an exploration and search mechanism that not only will it do the traditional kinds of searches by country, by the types of activities that you're having, but you can also customize a search function for your own needs. So yes, we can. We can explore. We can frog leap others' innovations. We can experience best practices, good practices, practices that fail, and apply those learnings to business model development and how we move in the future. You participate, register your projects, your ideas on Hub, comment upon, rate programs that you see on Hub, become a Hub blogger, create a workplace, a workspace on Hub to work together. We'll be creating something also for developers, so the software engineers of the world who want to come together and build something big, not to meet the 35,000 women of reproductive age in Bihar, but the 35 million women of reproductive age in Bihar. That's a different construct. There are special initiative places on Hub. I'm particularly partial to the Maternal Newborn mHealth Initiative. But the issues of interoperability, we've heard a lot about business models today and yesterday. What kinds of business models will work? Well, let's share those on Hub and see if we can build upon each other's knowledge base. What can we learn? Well, we're involved with the Pan American Health Organization at the mHealth Alliance, helping to create an mHealth policy framework for Latin America and the Caribbean. So, how many other countries need a policy framework for mHealth, for eHealth? Can Kenya use some of the things that the PAHO group might come up with? What about Nigeria, South Africa, vice versa? How many countries can adopt something similar to the M-Pesa opportunity in Kenya? Well, you can learn about more about it on Hub. Your ministerial staff can learn about it and let the ministers of health know. The policy frameworks for working with mobile access to health and the health data on mobiles is going to be really, really important. So one of the things that came up a couple of weeks ago about the Kenya policy framework is if we're going to store our data, our health data, our personal health record on the cloud, where is the cloud? Does the cloud exist within the confines of our border? If it does, then it's compliant with our national health policy, which says that data must stay in our country. Where is the cloud? What do we know? Where is the cloud? I don't know. And this, how will you find your partners? We've heard about public-private partnerships, private-private partnerships, private developer partnerships, public developer partnerships. Where will you find your partners? So there's a Norfund, venture capital arm of the Norwegian government. Where are you going to find venture capital places to put your venture capital? How great would it be if donors, venture capitalists, can go on the Hub space and learn worldwide what's happening about mHealth, eHealth, telemedicine in the world. So we hope to collaboratively build and maintain this web portal, all of us, by registering your projects, thinking about your ideas, working on things together so that, as Richard Klausner said, you know, innovation is sort of a grand dance of opportunity, naivete, and expertise. And I would say that Hub is our dance hall. So thanks very much.
Thank you, Jennifer. Next, I'd like to introduce Charlotte Erzball with Novo Nordisk. Charlotte is the Corporate Vice President for Global Stakeholder Engagement. As many of you know, Novo Nordisk has been involved in these issues, and she's going to announce how they're going to get more involved. So thank you very much.
Thank you very much. These days, the world community is actually coming together to talk about what we can do in order to break the curve for non-communicable diseases. And Secretary General Ban Ki-moon on Monday announced that while the whole world community has been focused for many years on the communicable diseases, the NCDs has basically gone unnoticed, particularly in the developing world. And this is creating a major challenge, both for economic development and also for socioeconomic development. And this is why Novo Nordisk, that is a company focused on diabetes, has taken an interest in how we can prevent diabetes and other NCDs. And right now, there is a lot of science coming to the fore that is presenting us with an opportunity, because it seems as if the lifelong risk of developing NCDs like diabetes and cardiovascular disease is actually being generated even before we're born. So this is another reason why it makes sense to invest in teenage girls' health, in pregnant women's health, in mothers' health, and the health of very young children. And so this is what we want to do. And we have been setting up a collaboration with Johnson & Johnson and PepsiCo and the UN Foundation to try and see how we can generate interventions that builds and capitalizes on already existing initiatives that seeks to promote the health of pregnant women in particular and teenage girls' health. And so this is really an integrative approach. It would be community-based, and our hope is that we can break the curve for diabetes. We hope that we can create a platform for generating more evidence, intervention-based evidence. We also hope that we can use this as another advocacy platform to really focus on why it makes sense to empower women to take care of their health and build health literacy, and focusing on the access to health from everything that goes from nutrition to information to care. And of course, where Novo Nordisk is coming into this is particularly in the field of gestational diabetes, which is right now a big worry to a lot of people around the world because it's growing very rapidly. And what is as the crux of this is that diabetes and other NCDs is actually happening in the advent of economic development. So just as countries are moving out of poverty, and people are moving into cities, they're adopting a lifestyle that is very unhealthy for them. And so this is going to be one of our focus areas to try and deal with how we can promote sustainable development in the advent of economic development. So we're very excited about this. We're just in the beginning of this, but we think that with these partners, with the core capabilities that we all can contribute, we can really make a contribution to this agenda. Thank you very much.
Well, thank you, Charlotte, and thank you for all of the good leadership that Novo Nordisk is showing on this agenda. Next, I'd like to call Doris Rouse to the stage. Doris is Vice President for Global Health at RTI International. And since there have been a lot of references to schools, I'm happy to say that we're both fellow graduates of Duke University, which I hope most people have heard of, but maybe not in Norway. So Doris, please.
Thank you. It's a point to be proud of. Thank you. It's a pleasure to be here. I appreciate the UN Foundation providing the opportunity for me to speak to and announce to you the output of an initiative supported by the Bill and Melinda Gates Foundation, and we call that initiative MANDATE, Maternal and Neonatal Directed Assessment of Technology. And the output that I'm going to speak to briefly, congratulations for being here, we appreciate it, is the upcoming availability of a new decision support tool that will be on the web, freely available to the global health community, that should be valuable in guiding strategies for addressing maternal and neonatal mortalities. Now, Lois Kwan this morning spoke impressively, eloquently, and with great compassion to the need for innovation in reducing maternal and neonatal mortalities. As we heard, more than 98% of the deaths of pregnant women occur in low-resource settings, and primarily of causes that are readily prevented or treated in more wealthy nations. Well, foundations, governments, and companies, as we've heard over the last day or two, plan to invest in developing or adapting technologies to address this really stunning health disparity. This initiative, mandate, will provide a quantitative model that will inform these technology strategies by guiding these companies, governments, and foundations to those areas and approaches where they have the potential for the greatest impact. Our approach in this model is first to gather the data on 7 conditions, 4 maternal and 3 neonatal, that address 75% now of the mortality currently. To gather the data from a variety of sources, including some in-country research to fill the substantial gaps, on how many women and newborns are dying of each condition in each country in sub-Saharan Africa and all the states of India where we have currently worked. Not just in each country, but in each setting, the home, the clinic, and the hospital setting, because the interventions are going to be vastly different, and we need to inform developers of technology of what those differences are. Then after we have those data in the model, we develop a clinical tree, cause tree, or a clinical algorithm for prevention, diagnosis, and treatment of each of those conditions. And then we're ready to match against that clinical cause tree at every stage for prevention, diagnosis, and treatment those technologies that are currently available. And we develop tech briefs or assessments of those technologies. And this is a way that you mentioned in the conception of a new technology, you need to look at what's already available. This will be an easy way for the inventor to see what's currently available in these treatments. But we'll develop tech briefs that will describe those current technologies, but also describe where there needs to be improvements in order to make them more appropriate for the settings, either home or community clinic or hospital. And by the way, half of the 60 million deaths of the births that take place annually take place in the home environment. So that's a real focus of the Gates Foundation in our work here. So we look at those technologies to try to find parameters by which they could increase their availability. Cost is a major driver there, but there are other issues as well. What are other parameters that can improve their utilization? Are they well matched to the skills of the care provider in those different settings or in the infrastructure that's available? If it requires too much electricity, we can get our chargers available, but it may require clean water. We need to make sure that the technology matches the environment in which it's going to be implemented. And then finally, how efficacious or effective is it? Too often our inventors look at just the effectiveness, and that's fine, but if it's not available or if it can't be used by the provider in that environment, then you're not going to have an impact. So we need to look at that continuum of factors. So with this decision support tool, an inventor in any of these organizations can look at where should we be investing. That is, where would any innovation have the greatest impact or have the greatest potential for saving lives? You'll know that from the data that we've input. And not only tell you where to invest, what conditions and what countries, but how to invest. That is, what parameters should I be addressing in my new technology? So with this model then, an inventor could come in and it'll be on the web. You can develop your own scenarios and not just look at one technology, but the impact of a change in a suite of technologies combined with a potential change in the transfer rate from the home to the clinic to the hospital. So if an inventor went in and said, well, if I make a better blood pressure cuff that could be used in the home, let me see what the impact of that would be. And I've done that analysis, and the impact is not very large. But if you could also measure proteinuria, then you could have a greater impact, but you could have even a much, much better impact if you could increase the transfer rate from the home to the clinic setting. So if you diagnose hypertension in the woman and there's protein in their urine, then there's a real possibility they're going to proceed to preeclampsia, eclampsia, go into seizure and coma. So you're not going to be able to treat that at home. So the diagnostics will be helpful if you can then move the woman from the home to the clinic. So you need to not just look at the technology, but the health service system that you can incentivize or provide the ambulance services, as in India they've begun doing, to move them to another environment. So this model, again, developed by my organization, RTI International, with support from the Gates Foundation, will be available in October on our website, which is mnhtech.org, as in maternal neonatal health tech.org. And I have a number of flyers here with our website on it. They'll describe more about it. It will be interactive. You can go to the website now and learn about the technologies, about this initiative. We have all of our data on there now about the number of women dying by various conditions. And I wanted to announce here today to stimulate two things. One is your input. As you see the model, we want input. We want this to be a conversation on how we can change it to better meet your needs. We also want input on evolving technologies. We'll have technologies that are available, but with this network, technologies are under development, and we want those reflected in the site as well. And I also want to stimulate uptake. This model can only have impact if a broad spectrum of the global health community, in fact, uses it in developing their strategies for maternal and neonatal health. Thank you.
Thank you, Doris. I've gotten about 5 different cutoff signs from the back of the room, so I'm going to just mention really quickly one of the other things the UN Foundation is doing, which is a partnership with the UN Global Compact. I want to acknowledge Johnson & Johnson and Novo Nordisk, who are going to be partnering with us on that because they're here in the room, but it's something I'm happy to talk about more in the connection section. And also, I want to acknowledge our upcoming partnership with Dow Corning. Mary Lou Benecki and John Breck are here, and that's going to be announced later this year, but we're really excited about it for our Alliance on Clean Cook Stoves. So thank you all very much, and enjoy the rest of the program.